COVID-19 and pregnancy is a big topic and a concern of all our patients. And it's really a very, very scary time to be thinking about getting pregnant or being pregnant during a pandemic. So, what are the things that we know about COVID? So, first of all, people originally thought that being pregnant may increase your chances of getting COVID because of the fact that pregnancy alters your immune system. However, that has not come to fruition, and it does not appear that pregnant women are at increased risk. What we do know is those people who are pregnant, and just like any other person out there that has other risk factors, such as underlying medical conditions, diabetes, hypertension, obesity, heart disease, respiratory problems, all those people are going to be at an increased risk for potentially a more severe case of the infection if they were to contract it. This goes for people who are pregnant with COVID as well. So, third, what do we know about transmission from the mother to the baby? And that's what we call vertical transmission. So what we looked at before was at SARS and MERS, which were in the world many years ago, or not many, but a few years ago. And what we found from those viruses is that there was very little risk of transmission. Not much has been able to be really elucidated from the data that we have currently. There have been a lot of case reports out there of potential newborns that have been testing positive for COVID. A lot of those reports were not well controlled. A recent publication from Nature, however, did show a potential vertical transmission of a newborn from a mother who tested positive. However, that's one case report, and we still don't know whether the risk of this is high or low. So we still need to look at more data. There is currently a study being undertaken by UCSF, which will enroll people who are currently pregnant or get pregnant during the pandemic, and we'll be following them to look at outcomes as well as risks during pregnancy and at time of delivery. The idea that COVID may affect you in the future is unclear. We still don't know whether there's any long-term effects from COVID, even on your just general health. And as far as women and their risk of getting issues from COVID, such as decreasing their fertility, that is completely unclear at this time. The number of people that are allowed into the office. So unfortunately, we're only allowing patients to come in, no partners or friends. We are taking temperatures at the door. We require masks at all times within our facility. And we are testing all our IVF patients during stimulation and prior to egg retrieval to make sure that everyone is negative to protect not only them, but ourselves as well.